As we've noted, Chicago and the state of Illinois are set to fully reopen after nearly 15 months of pandemic restrictions. That means starting tomorrow, people who are fully vaccinated can go without masks in most situations, although there are exceptions for congregate settings and public transport, and masks are still recommended for the unvaccinated. Conventions, festivals, and other large events can go ahead without COVID capacity restrictions. The outdoor mask requirement for schools will be lifted in line with CDC guidelines, but businesses are encouraged to continue to allow social distancing, especially indoors. Joining us now to talk about the reopening is Dr. Allison Arwady, Commissioner of the Chicago Department of Public Health. Commissioner Arwady, thank you for joining us. This must be a pretty big event for you, given everything that the city has gone through.
It is. We are so excited to be at a point where COVID's not over, but boy, is it the time to move ahead with reopening and enjoy this amazing city this summer.
Well, how confident are you that given this lifting of restrictions in large part, that there might not be a resurgence?
So we're really feeling good, particularly in the short term here. The biggest piece of this has been due to vaccines, but we're at a point where we are at the lowest cases, the lowest hospitalizations, the lowest ICU, and everything is heading in the right direction. And it's been doing that while we've been turning that dial on reopening. So absolutely, we have no threat right now to our healthcare system. We have a widely available vaccine, and our numbers are heading the right way. So it is the time to reopen, even if COVID's not entirely over. It's a great day.
Doctor, this week it was confirmed that the Delta variant, which was first identified in India, has now been discovered in Illinois. In fact, there are about 100 variants in Illinois. How big a threat are those variants?
So we've detected all of the known variants of concern here in Illinois and here in Chicago. The good news is that all three of the authorized vaccines here in the U.S. do remain protective against all of the known variants, although we start to see perhaps some decrease in that protection. So certainly we're concerned where we see new variants emerging, and we double down on our work with contact tracing and working to contain that. But really the most important thing is that if we can get even more people vaccinated, we won't have as much opportunity for these more potentially contagious or potentially more dangerous variants to take hold even more.
Speaking of people who are unvaccinated, cases of the coronavirus remain highest among African American Chicagoans, and in fact the vaccination rate is highest on the South Side. What to do about that?
So yeah, we're definitely seeing the highest rates of vaccination in white and Asian Chicagoans, and lagging somewhat in Latinx Chicagoans, and then even further behind among Black Chicagoans. And we're very focused on the less vaccinated neighborhoods, because that is absolutely where we are seeing cases, hospitalizations, even deaths being clustered. And that all has to do with the fact that the social networks are not well vaccinated. So what we've seen is, since vaccine has been available, the first opportunity people in Chicago had to be fully vaccinated was in January. 97% of the hospitalizations here in Chicago have been in people who were not fully vaccinated. 98% of the deaths in people who are not fully vaccinated. So we're doing a lot of work, especially in the 13 least vaccinated communities, literally going door to door, knocking on every door, signing people up for vaccines on the spot, sending our buses out, going to parks and beaches, going to food pantries and job fairs, going to schools, going to churches, going to festivals, going to wherever people are to make vaccine easily available, and then trying to pair that with good community messaging from trusted messengers who have gotten the vaccine and seen how it can really lead to less worry and help protect the community.
Yesterday, the CDC announced that the State Department of Public Health, that Cook County's Department of Public Health, and the Chicago Department of Public Health will get more than $84 million to address COVID-related health disparities. How much money is the city getting, and what are you going to do with it, do you think?
So we're getting in the range of $30 million. It's really exciting. We are investing most of this toward what we're calling our health equity zones. So we've learned so much in COVID about how to work really well with community-based organizations, with our federally qualified health centers and other health partners. And we want to keep this network going. We've done a lot of hiring in partnership with community-based organizations, particularly on the west and south sides that have been hardest hit from COVID. And so as we look ahead, we want to be able to use the funding that is specifically focused on health equity and working on health disparities, which is already the core mission for the health department. We want to get that out to community-based organizations and move beyond COVID to think about chronic diseases and all of the other things that really make our opportunities to live long lives not equal here in Chicago.
Earlier this week, you said that the city was experiencing, quote, exponential decay in the number of COVID cases. Is the city at herd immunity levels yet?
So there's no magic number for herd immunity. If we were to see, quote, herd immunity, it would mean even if a case of COVID were detected, it really would not have anywhere to spread. Unfortunately, that's not what we're seeing. Where cases of COVID are detected, we continue through our contact tracing to see COVID spread, especially among very unvaccinated parts of the city or among groups of friends, families, neighbors that are not well vaccinated. So we're not at herd immunity. But the thing is, every time you break a chain of transmission, especially when numbers start to come under control, you can cut off more and more opportunities for COVID to spread. And that is what we're seeing. So I'm really confident looking ahead, particularly in the short term over this summer, that we will remain in good control, particularly if we keep making good progress on vaccination.
Even though cases are going down and there's this reopening push, is COVID something that people are just going to have to live with long term? Is this something that we're just going to have to continue to address in the way that it has been addressed in order to ameliorate its impact?
So we'll see. I do not expect that we will eradicate, meaning get rid of COVID entirely, unless there is, for example, a new medication that is developed that can completely eliminate it. And I don't see anything like that on the horizon shortly. It is also so widespread worldwide, and there are many countries that still have not even begun to vaccinate their population, and we have a really global society, that I do think COVID is here with us for some time. What we'll be watching for is to see how seasonal is this? Is this something that becomes part of our, cold and flu season? If it does, this could be something that we could need to be doing additional vaccinating around if we were to see cases return in the fall. We're setting up a lot of data monitoring to make sure we can understand and do more lab testing around things like variants, really make sure we're as prepared as we can be for whatever comes. But again, getting vaccinated is how we turn this from a disease that has killed so many people and just shattered so many people's lives in Chicago, potentially turn it into something that we don't have to worry about more than we do colds or other, some of the other viruses.
Dr. Arbody, thank you so much for your time on this very significant date. We appreciate it.
Thank you. It's such an exciting landmark. Thank you, Chicago, for getting us this far.